So today's class is part of the total body fix, and we're going to be focusing on the hips and the knees. So this is therapeutic exercise. So this class is specifically meant for individuals that are having problems or impairments in the hip and knee area. But it's also a very general class, so there's some exercises that might work for your body, and then there's some exercises that might not. So what I would advise, if for the ones that seem like they're not working or you're not ready for, it's okay, just stop, wait, and you'll be able to participate in the next exercise, okay? So this class will be great for individuals that are having knee and hip pain from maybe osteoarthritis, maybe some patellofemoral problems with the knee. If you've had a total hip or a total knee replacement, some of these exercises will be just great for that, and other exercises might not work, especially when we go into the deeper hip and knee flexion exercises. Okay, so what I want you to do, you can see that I'm down on the floor on a yoga mat. So if you have a problem getting up and down off the floor, you can do the laying down exercises on your bed. We're going to do some standing exercises as well. You want to make sure you have a belt or a strap, or you can even grab a towel. That will work as well. And you might need it, you might not, but grab a flat blanket or a beach towel. Some of the exercises you might need this just to pad or cushion yourself, okay? And we're going to go ahead and get started. So for those that just joined me, welcome. So today's class is therapeutic exercise for the hip and the knee. Okay, so we're going to start on the floor, and we're going to start with what I call some foundational exercises. So these exercises might be a little bit more on the simple side, but what I want you to really pay attention to is my instructions and how to really engage the muscle, okay? So they might be simple, but proper engagement is the key. So the first exercise, which is a great exercise for both the hip and the knee, is a straight leg raise, okay? So you want to come down. You can lay it all the way down if you like. That's the easiest position. You're going to see that I'm propped on my elbows. Just easier for me to talk in this position. So I have one leg bent up, and my left leg bent up, and my right leg is straight. So how I'm going to engage here is I'm going to flex my right foot. I'm going to push my heel forward, and I'm going to tighten this entire leg. So you want to keep that position the whole time. You want to keep that engagement. And then we're just going to lift straight up, no higher than the opposite knee. If you go any higher, then you're pulling out the muscles that I want you to focus on, okay? So just to the level of the opposite knee, and then just lower down. And we're going to do 10 of these. So lifting up, keeping that engagement, and lowering down. Now, if this is super simple for you, what you can do over time is you're going to progress to doing 3 sets of 10. And if that feels still pretty easy, then you can start using an ankle weight to give you a little bit more resistance. That's 4, 5, 6, 7, 8, 9, and 10, okay? So if you're keeping the full engagement, this simple foundational exercise can be pretty challenging. Okay, so we're going to switch legs. So straighten the left leg, keep the foot flexed, pointing straight up towards the ceiling. Now push your heel forward so you feel your entire leg engaged. And now we're going to lift, no higher than the opposite knee. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, I want you to switch again. We're going to do the exact same thing. So strong leg, flex the foot, push the heel forward. 1, 2, 3, 4, 5, 6, 7, 8. Keeping the engagement. 9 and 10. Okay, let's do it one more time. Switch. So keep the foot flexed, keep that leg strong, keep it engaged, and let's lift. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. So now we're going to take a little break by doing a stretch. So I want you to lay all the way down for me. So lay on your back. And from here, you're going to lift your right leg. So I want you to take your left leg, ground it down into the floor. So you're going to grab hold of behind the thigh. If this is too strenuous, this is where you're going to use your strap or your belt, okay? If you're having back pain, then bend this opposite leg up. If you're not having back pain, straighten it and push that left leg down. Keep your right foot flexed. And we're going to hold this for 5 breaths. So deep breath in through the nose and deep breath out. 1, 2, 3, 4, and 5. Okay, great. And go ahead and let's just switch sides. So ground down your right leg, lift the left, keep the foot flexed. Trying to straighten the leg as best you can. It's okay if it doesn't go all the way straight, but keep this opposite leg grounded down. 1, 2, 3, 4, and 5. Okay, release. So we're going to move on to our next exercise. So we're going to come into that same position with one leg bent up. We're going to do another straight leg, right? It's just slightly different. So what I want you to do is let your foot turn out towards the side, but then do the same engagement. So straighten the leg, push the heel forward with the foot flexed. All right, so come a little bit wider this time. And what we're going to do is a diagonal motion. We're going to take this leg and bring it towards the opposite knee, but I'm moving more towards a diagonal. And what that's going to do is that's going to work our inner thigh muscles, the adductors, and also this large muscle called the sartorius. Okay, so keep the foot engaged and lift. 1, that diagonal plane. 2, 3, 4, 5, 6, keep breathing, keep the leg engaged. 7, 8, 9, and 10. Okay, and we're going to switch. All right, so opposite leg is bent. So I'm propped up on my elbows. This is actually a more challenging position, and that's because it's easier for me to speak into the phone. All right, I'm turning the foot out. Keep the leg strong and lifting. 1, 2, 3, 4. Keep breathing. 5, 6, 7, 8, 9, and 10. Okay, just switch. We're going to do one more set on each side. So keep the leg flexed, really strong, pushing the heel straight ahead, lift. 1, that diagonal motion. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. Let's switch again. So flexing the foot, strong leg, diagonal. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. Now we're just going to do a stretch. So I want you to take your right leg, pull it in towards your chest, and let it butterfly out. It's okay if this leg doesn't come all the way down to the floor. It's okay if you're up like that. If that's too uncomfortable with your leg in the air like that, you can also grab your blanket that you have nearby and help support it that way. All right. So letting this leg butterfly out. So your opposite leg, your left leg is going to be straight and strong, okay? And from here, I want you to pull in the belly, lift up through your chest, and reach for that left foot. And we're going to hold this for 5 breaths. 1, 2, 3, 4, and 5. Okay, we're just going to switch. So take your left leg, first pull it in towards the chest and let it butterfly out. The right leg is straight and strong. The foot is flexed. Do it this way, you can see me a little bit better. The foot is flexed, and from here, pull in the belly, lift the chest, and reach towards that right foot and ankle. Try to stay long, try not to just round down. So try to stay lifted even though you're reaching forward. And breathe here. 1, 2, 3, 4, and 5. Okay, great. So we're coming down back on the mats. Move out of the way, little guy. Okay, so we're gonna lay on your side. All right, and we're gonna work now our hip abductors a little bit. So my legs are straight. So I actually want you to take this bottom leg, bend it up more towards your chest, and slightly extend this top leg back a little bit, all right? So same principles. I want you to straighten out the leg as much as you can, push the heel forward, and slightly, very slightly turn your toes up towards the ceiling without compromising or rolling your body, okay? So let me say that again, all right? So we're bottom leg, slightly bringing it up towards the chest. That's going to neutralize your spine. This top leg is straight and strong. The foot is flexed and slightly turning the toes more up towards the ceiling, okay? So you can come all the way down, and from here, we're going to lift up. 1. Try not to let the leg scoot forward. Try to keep it back in that extended position. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. We're just going to flip to the other side. Okay, so legs straight to start. Take your bottom leg, pull it up towards the chest, just a little bit. It doesn't have to touch your chest. And then from here, the top leg is straight. Flex the foot, but slightly bring it back. Now bring your toes slightly up towards the ceiling. Okay, so don't roll the body, just gently rolling the toes up and lift. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay? If you are having any hip discomfort, the hip that you're laying on, this is where you can use your blanket as a pad just to give you a little bit more cushion. So we're going to do one more set on each side. Okay, legs straight, pull the bottom leg up towards the chest. Back, top leg is straight, slightly bring the leg back, toes pointing up. 1, 2, keep the leg engaged. 3, 4, 5, 6, 7, 8, 9, and 10. Okay, let's switch. Other side. Okay. So legs straight, pull the bottom leg up towards the chest. Top leg is extended back, toes pointing up towards the ceiling. Strong leg, 1. Just breathe here, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. So if you have that belt, if you have that strap nearby, go ahead and grab it for me. All right, so I'm just looping my strap around my shoe. All right, and I'm just gonna bring my foot up, not all the way, but up a little bit. And from here, I just want you to slightly bring it across the body. So you're getting a stretch to what's called the iliotibial band, the IT band. And we're gonna hold this for 5 breaths. So your opposite leg, keep it rounded down. It's okay if this right hip lifts off the floor a little bit. Just don't roll the torso, keep the shoulders down, and breathe here. 1, 2, 3, 4, and 5. Okay, great. We're just going to switch sides. So looping that belt around the opposite foot. So grounding down your right foot. Keep this left leg strong and engaged. And just bringing it over just a little bit, enough that you're feeling a stretch along the IT band, getting into the outside of the gluteals, these outer hip abductors. 1. Deep breath in through the nose, deep breath out, breathe here. 2. Keep grounding down that opposite leg. 3, 4, and 5. Okay, great. So now we're going to switch to an all-fours position. So if you have sensitive knees, which I do have sensitive knees, I'm going to use my blanket as just a little bit of padding. Okay, so I'm going to come into an all-fours position, and I'm going to take my right leg and I'm going to extend it up. So all the things I've been telling you about. So keep the leg straight and strong, keep the foot flexed. Now as you're in this position, pull in your belly for me, and we're just going to lift this leg up. Just nice and strong, not enough that you are hurting your back as you lift. 2, 3, 4, 5, 6, 7, 8. Keep the leg engaged, keep the foot flexed. 9, and 10. Okay, just go ahead and switch. So the leg is straight, the foot is flexed. Keep your belly pulled in. Push through both hands equally and lift. 1, 2, 3, 4, going to do one more set on each side. So go ahead and switch for me. So straighten out that right leg, keep the foot flexed, push through the hands, keep your belly pulled in, keep the leg strong and lift. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. Switch. So strong leg, foot is flexed, belly's pulled in, and lift. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, awesome. I want you to lay down on your belly for me. Go ahead and grab your strap. We're going to loop it around our right foot. So coming all the way down, we're going to do a quad stretch. Okay, and from here, I'm going to take my foot and I'm gently going to bring my heel towards my butt. Using the strap, you can also reach back and use your hand too if you're a little bit more on the bendy side. Either is fine. So try not to let the leg that you're stretching splay out. Keep your knee in line with the hip. Keep your head relaxed. And we're going to hold for 5 breaths. So the goal is eventually that you feel your heel hitting the bum. And breathe. 1, 2, 3, 4, and 5. Okay, and just release. We're going to go ahead and switch sides. So looping your belt or your strap around that left foot, laying on the belly. Okay, and from here, just pulling that heel towards the butt. Now try to keep the knee in line with the hip. Don't let the legs splay out. Breathe in through the nose, breathe out. 1, 2, just relax your neck, relax your shoulders. 3, 4, and 5. Okay, great. You can get rid of the strap. Great, and we're going to come back into that same position on our hands and knees. And this time, let me just switch this leg. This time, so pull in the belly, push through the hands, and from here, we're going to lift the leg out towards the side and back down. So working into those hip abductors. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. Let's switch sides. So move to the other side. So lifting the leg up. 1. Equally push through the hands. Keep your belly tucked in. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, we're just going to switch, do one more set on each side. Okay, pull in the belly, push through the hands, and lift. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, let's switch sides, push the hands, reset, pull in the belly, lift the leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Great. Okay, so we're just going to move into a stretch. You definitely want to pad the knee. So from here, the leg that I'm stretching is going to be the right one here. So my left leg is bent at this 90-degree angle. So we're going to be stretching out what's called the psoas, this hip flexor muscle. Okay, so I want you to listen to me. You can stay close to a wall or have a piece of furniture. This isn't a balance activity, so that is fine. And from here, I want you to pull in the belly, lift up the chest. Keep the belly tucked in as you bring the pelvis forward. So what you don't want to do is you just don't want to lean forward. We're staying upright, okay? But you want to make sure you're pulling in the belly so we're getting a nice stretch into that right hip flexor. And breathe here. 1. Deep breath in through the nose and deep breath out. 2, 3, 4, and 5. Okay, great. We're just going to switch. So bending into that right, the right knee is bent, but we're stretching the left. So do all the things. So pull in the belly, lift the chest, stay pulled in and lifted as you just bring the pelvis forward. 1, feeling that stretch in that left hip flexor. 2, if you're having any knee pain, make sure you're patting the knee underneath. 3, 4, and 5. Okay, great. Let's release that. And we're going to do one more in this quadruped position. So that's quadruped is on your hands and knees. So from here, we're pushing through our hands. We're going to keep the knee bent as we just lift it straight up into this donkey kick position. Keep the foot flexed. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, and let's switch. Let's do the other side, really working into our gluteals muscles, keeping the foot flexed and lift. 1, keep your belly pulled in. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, we're going to do one more set on each side. Right foot is flexed, belly's pulled in, and lift. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, let's switch. One more set of these. So keeping the foot flexed, keep the belly pulled in, push to the hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. So from here, we're gonna just have a seat. And I want you to spread your legs apart as wide as they'll go. All right, so feet are pointing straight up towards the ceiling. Don't let the legs roll in. If anything, let them roll out a little bit. So keep the legs strong and active. Keep the feet flexed. We're pushing the heels out. Pull in your belly, lift the chest now, really ground down your sits bones, and we're just gonna reach forward. Now, maybe just sitting here, staying upright is enough of a stretch, that's fine. Okay? So breathing in through the nose, breathing out, 1. So we're working on stretching out these long adductors. 2, 3, 4, and 5. Okay, great. We're gonna lay down on our back now. We're gonna work into a few bridges. So you wanna lay down on your back with the knees bent up. So the hips should be in line with the knees. Don't let your knees fall together. The feet should be apart. So the ankles, the knees, and the hips all are in the same line. And from here, I want you to lift up your pelvis, really ground down your heels so much that you could even lift the toes off the floor and all the way back down. We're going to do 10 of these and just breathe into it. Inhale up and exhale down. Inhale, come all the way up, really push through those heels, shoot your shins forward, and exhale, come on back down. 3, lifting up. 4, 5, 6, 7, 8, 9, and 10. Okay, great. So take your left leg, straighten it, push it straight down towards the floor, grab hold of the right knee and just pull it in towards your chest. So we're stretching out the glutes, stretching out that hip, just pulling it in as much as you can. Just try to keep the shoulders and head relaxed, and let's just hold it for 5. 1, 2, don't forget about the left leg, grounding it down towards the floor. 3, 4, and 5. Okay, go ahead and switch. Grab hold of that left leg, pulling it in, but ground down the right. If you're having any back pain, of course you can bend this opposite leg up. Otherwise, ground it down. 1, 2, 3, 4, and 5. Okay, and just release. Let's come back into our bridge. We're just going to progress with this. All right, so I want you to straighten your right leg. The left leg is going to be bent. Okay, so strong and straight, just like we were doing our straight leg raise right at the beginning. The foot is flexed. You're going to keep your belly pulled in, and I want you to lift and back down. Lift and back down. A little bit harder, right? Lift and back down. If this is too hard, just go back to doing a normal bridge, up and down. We'll say that's 4, 5, 6, keep the foot flexed, keep the leg strong, 7, 8, 9, and 10. Okay? Switch sides. Again, if that was too challenging, just do another set of the bridges for me, okay? So the left leg is straight and strong, the foot is flexed, and let's lift it up and back down. Try not to fling the leg up, keep it controlled. 2, nice lowering down, slow lowering down. 3, 4, 5, 6, 7, keep your belly tucked in, keep the foot flexed. 8, 9, and 10. Okay, so from here I want you to take your right leg and let's come into that figure 4 position. We're going to stretch out one of our hip rotators, or hip rotators I should say, specifically targeting the piriformis. So I'm going to take my hand through the hole here and reach for the thigh. Now if you're struggling, this is where you can use your belt or a strap. A towel will work too. And we're just going to hold this for a count of 5. Try to keep the head relaxed if you can. Keep the shoulders relaxed down. 1, 2, 3, 4, and 5. Okay, we're just going to switch sides. So come into your figure 4 on the left, all right, and grabbing hold of the thigh, and you can use a strap. Keep the feet flexed. Just breathe here. Shoulders relaxed, head relaxed. 1, 2, 3, 4, and 5. Okay, release it down back to our bridge position. All right, we're going to do one more set of these, okay? So from this time what we're going to do is we're going to lift all the way up. I want you to come up onto your tippy toes, heels down, and then lower all the way down. Okay, that was 1. Lifting up, tippy toes, lower down, and all the way down. 2. Lifting up, tippy toes, heels down, lower down. 3. Lifting up, tippy toes, heels down, lower down. 4. Lifting up, tippy toes, lower the heels down, lower down. 5. Lifting up, tippy toes, heels down, lower down. 6. Again, lifting up, tippy toes, lower the heels down, lower all the way down. 7. Lifting up, tippy toes, heels down, lower down. 8, again, lifting up, tippy toes, heels down, lower down. 9, and again, lifting up, tippy toes, lower the heels down, and lower all the way down. Okay, great. So we're just going to come to a seated position, and we're going to do a stretch, butterfly stretch. So you want to bring your feet together and just let your legs splay out. Okay, so from here, pull your belly and lift your chest. Try to get upright first. And if that feels okay, you might just stay right there. You're going to try to bring your chest forward, but try to stay long. Don't just round and slump into this. So really try to lift up. So pull in the belly, lift the chest, and try to reach the chest forward. 1, deep breath in through the nose, deep breath out. Now we're stretching out our short adductors. 2, 3, 4, and 5. Okay, great. We're going to finish with a little bit of standing work. Okay, so I want you to just come hips distance apart, toes slightly, very slightly pointing out. All right, so just bring one hand on each shoulder. We're going to do a squat. So when you do a squat, I want you to get real heavy through your heels. I want you to stick your butt out. So really sticking the butt out. Pretend like there's a chair right behind you and you're aiming for the chair. Now, how far you go in the squat is really up to you and maybe the impairments that you have. Like for example, if you had a total hip replacement, you're not going to want to go too deep with these. But if you have all your joints still, you feel free to go as far as you feel comfortable, as long as you're not having any pain, as long as you're sticking to these principles where you're getting heavy through the heels, letting the butt come back as we squat down and back up. Okay? 1, keep your belly tucked in. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. And from here, I want you to take your right leg and bring it in front. All right, we're going to do a lunge. Now, again, depending on your situation, if your joints are good and you're not having much pain, you can take your knee all the way down to the floor. If, though, you've had maybe some surgeries or some issues with the knee and the hip, you're just going to go where you feel comfortable. So it doesn't have to be all the way to the floor, but we're going to do 10 of these. So my right leg's in front. So what I really want you to pay attention to is your right kneecap. As you're bending into this right knee, make sure that right kneecap is moving straight over, basically where your second toe would be, okay? And lowering down for me. 1, you get to pick how low you're going. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, I just want you to switch. So now my left leg's in front. Again, you get to decide how low you're going. So really pay attention to this left knee. Remember, the left kneecap is moving straight over where your second toe would be. Okay, keep your belly pulled in, keep the chest lifted as you lower down just to your degree. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, great. So we're going to do another set of squats. So get in the same position, one hand on either side of the shoulder. Get nice and heavy through your heels, pull in the belly. So really sink the butt back. So you're bending down as low as you feel comfortable. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, I have one more exercise for us. So I want you to go as wide as you can tolerate here. We're going to do a side lunge. So we're going to bend into our right knee. So bending into this knee as we're dropping down. So if you take a look at my left foot, it's flexed and bending straight up towards the ceiling. And then I'm going to switch and come to the other side. We're just going to do 10, 5 on each side. So lowering down again, you get to choose how much you're lowering. 2, if you want to extra workout, you're going to lower low. If maybe your hips and your knees don't allow it, you're going to keep it a little bit gentler. 3, 4, 5, let's do one more. I think I miscounted on each side. And we'll finish there. Okay, everyone. Well, I hope you enjoyed the class. I hope you maybe learned some helpful exercises for you in the future. So if any of these exercises were, say, too easy for you, then what you're going to do is you're just going to maybe try to do 3 sets of 10. And if they continue to be easy, that's when you would maybe add an ankle weight to help you with the exercises. Also, too, with these standing ones, you can start to increase how many repetitions you're doing. So I would start there first, and then you can always switch on to maybe holding some weights to give yourself a little bit more